evening everyone. As we are heading up to Patient Safety Week, from NRI, we have made this poster presentation telephone booth in order to make awareness to each and everyone of international patient safety goals and on patient safety. Patient safety, JCI has laid international patient safety goals. There are 6 goals. One is identify patient correctly, and second one is improves effective communication. Third one is improves the safety of high alert medications, which will be maintained under the lock and key, and fourth one is ensures safe surgery, correct site, correct procedure, and fifth one is reduce the risk of healthcare associated infection, and sixth one is reduce the risk of patient harm resulting from falls. By the patient. Actually, can you imagine yourself not having a name, or else when you are called a different name? Actually, you cannot imagine without a name. So, in order to identify a patient, actually every hospital is having 2 identifiers. One is patient's name, another is date of birth and medical records number. Find out patient identifiers. Firstly, the patient's ID band, where you can find patient's name and MR number, and patient's chart holder. Chart holder is nothing but the patient's file and patient.
Hi Mrs. Sunita, how are you? I'm Rajesh, I'm your nurse. I'm giving you some medications to relieve your fever. Injection name paracetamol. Before giving injection, I will confirm your identity. Please show your identity. Okay, Miss Sunita. ID number 201964. Okay, thank you. I'm giving you injection. It will give you some pain. Please follow. Thank you, Senator.
And this is all about the patient identification. And coming to second goal, improves patient effective communication. So, in order to maintain effective communication, we need to maintain ACT that your communication should be accurate, complete, clear, and communication should be in a timely manner. So, in order to maintain effective communication in hospital setup, we need to follow this ISBAR technique. ISBAR is nothing but identification, S is nothing but situation, A is nothing but background, A for assessment, and R for recommendation. Whenever we follow these ISBAR techniques, there are most prone communication errors. The 2 types are verbal telephone order and critical value results. Whenever are we allowed to take verbal and telephone orders? No. Actually, verbal and telephone orders should be restricted for only emergency situations. Okay?
Hello.
Good afternoon, Dr. Supraja.
Good afternoon, Dr.
This is Brother Sudhir calling from second floor cash rooms regarding your client, Mr. Andrews Cooper.
Okay.
Mr. Andrews Cooper had one spike of temperature 101.1 degree Fahrenheit. He is a diagnosed case of carcinoma tongue, operated second post-op day, left hemiglossectomy. Actually, patient is not having any comorbidities. Right now, Mr. Andrews' pulse rate is 99 beats per minute, respiratory rate 24 per minute, blood pressure is 138 by 76 or mm of Hg. Saturations 99% on room air.
Okay.
Dr. Supraja, would you like to suggest me any medications regarding hike in
Okay, Brother
temperature?
Sudhir, please give injection paracetamol, IV stat.
Dr. Supraja, you have ordered paracetamol, paracetamol, 1 gram IV
Yes,
stat.
right.
Thank you, Dr. Supraja. I will carry out your verbal order. And once when you are for a patient visit, please document your verbal order.
Okay, Brother Sudhir. I'll document my verbal order once I visit the patient. Thank you.
Thank you, Dr. Supraja. Have a nice day. Every year, patient safety we will be having a theme. This 2021 theme is safe maternal and newborn care. As we don't have a scope of maternity and child care, so in order to make sure we treat every patient is like a child. Last but not the least, patient safety is in the hands of every healthcare personnel in the hospital.